Welcome to Beauty Unveiled. I'm Dr. Angela Sturm, a double board certified facial plastic surgeon in Houston, Texas. And here we talk about all of the nuts and bolts of how facial plastic surgery works and answer any questions that you might have but don't know who to ask. And today we are going to ask what happens if you have a facelift after significant weight loss. And this is actually one of my favorite things to do, is do a facelift after someone has lost a significant amount of weight. And that's, between 50 and 100 pounds, sometimes more. It's amazing. These people have gone on this incredible journey. They're becoming their best self, and they have chose to allow us to be part of that. And I think it's just absolutely beautiful, and I love that. I love doing this as well because you're able to get a really amazing result with these people. They have extra skin, and as they've lost the weight, you're really able to see like their bone structure and get them this really pretty jawline, this really tight neck, and really look at youthful, and that goes along with their best, healthiest self. What is different between doing a facelift on just anybody and doing someone that has lost a significant amount of weight is that they've lost the volume in their face. And so this may be somebody that can be on the younger side, although I've had people all the way in their 60s and up to almost 70 who have lost a significant amount of weight and want to feel better and look better. A lot of the people that I've seen and I've operated on are on the younger side. They have really good skin, and you can really see that nice bone structure, but it does age them beyond what they actually are, because you're seeing, the jowling and the loose skin in the neck, and and the volume loss in their cheeks and around their eyes. And so that's something that we can give back to them so they look their age, if not younger. Their skin may not be as elastic as it was, because think of it like a balloon, where you start with a balloon, you blow it up, and then when you let the air out, it doesn't quite go back to the way that it was before. So the skin has lost some elasticity. So whenever I do the facelifts, I do like to be a little bit more aggressive with the lift, knowing that it may relax a bit over time. And so it's just planning ahead, knowing that may be the case, and knowing everyone's skin's a little bit different, and just with experience being able to look at someone's skin, feel it, and know kind of how it's going to behave once you do that facelift. Also, there is some volume replacement because they have lost volume in their face. The lift is going to do a lot, but you can do fat transfer. You take it from other parts of the body where you do lipo on the tummy or the legs, and you take that fat and then inject it into the areas where they've lost their own fat. I do like to be conservative with this because the fat has changed and they have lost it, and sometimes there is a little more of the weight fluctuation that will happen along their journey, and you want it to be within that range of, if they do have a fluctuation, it's not a big deal. It's not a big difference in the way that their face looks. And I do like to have a really good conversation with people about where they're at in their journey, and are you at that plateau where you feel really comfortable, but between, if it's the medications or the diet and exercise, this is a place that you can maintain and want to maintain for a long time, because I want to get this as good as possible, and then I don't want it to look more full if we happen to gain weight, or have more of that crepey skin if you lose more weight. I want this to look as good as possible for as long as possible. And people totally understand that, because if you're doing all of this, you don't want to do it and then it not be what you want it to be. So it's planning ahead in those ways of, how do we make this result as good as I can for you, with the lifting, with the adjunctive procedures. At times, if someone does have some of that fluctuation, and maybe if their skin isn't as elastic as we would like for it to be, we can combine it with some of the non-surgical treatments to get the best result. And so do the facelift, get our very best result that we can from that. And then if we need a little bit of tightening or resurfacing, we have those technologies in our office to be able to bring that together as a package for that patient of their whole treatment plan. Another consideration, if you are on like a GLP-1, and that has been the way that you've been able to lose your weight, which is something that has worked for a lot of people. Prior to surgery, we do have you stop that for 2 weeks, because it does slow down your digestive system, and that's kind of how it works. But if we need you to not eat or drink anything after midnight, it's not going to be long enough if you are on one of those medications, and want you to be completely safe from the anesthetic perspective. So something else to keep in mind, just planning wise, if you're thinking about having surgery, that's one of those things that your surgeon will ask you to do. You can get back on it pretty soon after surgery. It's not going to affect your long-term weight, but we just want to be as safe as possible. Like I said, these are some of my very favorite people to do facelifts on because you can get such an amazing result and be part of that process of them becoming their best self, and you get to be a part of it. So let me know if you have questions about doing facelifts after weight loss or anything facial plastic surgery. Please like, share, follow for more information, and you can find me at www.drangelaSturm.com, and you can find us there to schedule a consult.